We were very concerned a few months ago about the possibility of both COVID and influenza colliding together this fall.
Dr. Kristen England is an infectious disease physician at the Cleveland Clinic.
Everyone over the age of 6 months should really get a flu shot this year. There are different kinds of flu vaccines that are out on the market this year, and they appear to be more effective than they have in the past. We need to be doing everything that we can this season, even though we're hopeful for a lighter influenza season, because hopefully everyone's wearing masks and washing their hands and social distancing. That will protect you from influenza as well as COVID-19, but nothing is 100% perfect. So why not add the added benefit of getting an influenza vaccine? And that way, hopefully you won't get sick from either this season.
Now is the best time to get your flu shot.
Between now and say mid-October is really the optimal time to getting it done. It does take 2 weeks for the vaccine to reach full effectiveness. So we want to make sure that you get it in plenty of time for the beginning of flu season, but also we didn't want people to get it too early, say in August, because then their ability to prevent against influenza may wane, and we may not be able to get it to last until say May or June, when we can sometimes see flu season lasting.
How can you tell whether it's flu or COVID?
It's really tough to tell the difference. The symptoms are going to be quite similar. Each is going to have the potential for fever, cough, feeling short of breath, maybe some chest pain. Some people can have more of a diarrheal type illness that goes along with it, but both will typically have a lot of fatigue and a lot of muscle aches. There are a few things that are unique to COVID-19, most notably, you lose your sense of taste and your sense of smell. Although if you have the flu and you've got a lot of sinus congestion, you may be losing your sense of smell just because of that. But if you don't have that and you lose your sense of taste or smell, that's a pretty clear indicator it's COVID-19.
Speaking of COVID,
I don't think we're going to be getting a COVID vaccine anytime in the near future. It's not necessary that we're going to need to distance our flu vaccine and our COVID vaccine apart, and there's going to be plenty of storage in pharmacies and also in hospitals for the COVID vaccine when it comes. I wouldn't change your practice of flu vaccines just on the hopes that there's going to be a COVID vaccine sooner than later. I think it's, again, important, especially as we see a lot of kids going back to school. People are getting more active in their jobs as people are getting out and about more. We really need to take advantage of what we can do to keep ourselves and our communities healthy. Get your flu shot, wear your mask, wash your hands, and socially distance, and let's have a healthy end of 2020.
For Fox 8, I'm Dr. Mark.
Dr. Mark is sponsored by the Cleveland Clinic.